Good afternoon, everyone. On behalf of No Fear Project, we are proud and honored to be part of the European Forum on Disaster Risk Reduction 2021. My name is Chaim Rafalowski. I'm a disaster management person. For the last, in my organization, they will tell you 500 years, I've been telling my colleagues that one day we will have a large-scale pandemic. If you want to put it in official terms, it is on our contingency plan. Our contingency plans say one day we will have a pandemic. And then I will fly back in time to end of December 2019, where some rumors about something going on in China started going through. And then we had January, and in February, hell broke loose. Stories about people dying on the streets in China, something about the pandemic, which is global, going on everywhere. First cases in Israel coming from the Diamond Princess boat in Asia. And we had to start preparing and found ourselves with cases and with an outbreak in Israel, like all the colleagues around the globe in the healthcare sector. And we really didn't know where to go to. It was something new, something really scary, something we didn't have answers for many of the questions our colleagues asked us. And this is the moment we all turn to our strong network, the strong network of No Fear Project that really helped us better prepare and better respond to this great challenge, which is not over, is still going on. So today we are going to talk about international cooperation in the midst of a global pandemic. We are honored to have with us a very distinguished list of speakers. And without further ado, I would hand over to the No Fear Project coordinator, Professor Francesco Della Corte from CRIMEDIM. Professor Della Corte, please.
Coordinator of the No Fear Project. No Fear means a network of practitioners for emergency medical systems and critical care. In my figure, I am the responsible of the emergency department of my university hospital that is called Novara, a site in Novara, very close to between Milan and Turin. And we were at the very beginning of the COVID pandemic. We were the first hit by the pandemic because we were very close to Lombardy. That was the site, the region where the pandemic started. I am also the director of CRIMEDIM, that is a center of research of emergency and disaster medicine. Our project is built up with a consortium of 18 partners, has a duration of 5 years. In the last 2 years, the last third of the program is started now as is going on. It's a No Fear Project objectives are that to brings together a pan-European and beyond network of practitioners, suppliers, researchers, and policymakers. We all together to try to meet the goal or to achieve a common understanding of needs and priorities, to fill operational gaps, and to pinpoint areas for future research. So here is the mention of all the people who are involved in. We are covering quite all the surface of Europe, and we have also connection worldwide with a lot of people. We became higher in number after the outbreak of the COVID pandemic. So our network works on 3 main pillars. One is the acute care of the patient in emergency and disaster situation. operation in security-related incidents, and training and education of personnel and volunteers. These three main pillars are tied together transversally with two other topics that are concerning ethical, human, and social and legal issues, and also innovation monitoring and the uptake plan, just to give the participants, especially practitioners and academics, the possibility to get in contact with people delivering this newsness in the field of the pre-hospital care. So the project structure is based on this cycle, starting from the debate about lesson learned, needs, trends, with a focus on new threats, even if, to be sincere, at the very beginning in 1988, we didn't thought that we had passed most of our time on pandemias. That was something that came up from the blue. And it took, as we will see in a few slides, in the next slides, quite all the time that we are dealt with. So after this discussion on lesson learned, needs and trends, we try to extract current and future innovative solutions to give feedbacks on this possible solution and recommendation from practitioners and suppliers, and to exhibit and to work upon and to discuss all these feedbacks and recommendations during workshop and exercise and demonstration. So to give the flavor that something could be shared together to make it something that could be useful for the whole world of emergency medicine. So we had tools through which we had the possibility to work upon these objectives. One was a transactional dynamic portal that has been established by the University of Nice, and that is managed also altogether by us. That was the possibility to publish on that portal all the catalogs that we can change going on with the project. So it's a dynamic catalog to report the lesson learned and gaps that we look at. We had also thematic forum and library to improve our knowledge. And every 2 months, we had a project event that in different cases were workshops, showcases, debates, and full-scale exercise. We started with a kickoff in Novara, and after that, we moved to Madrid, and after that to Nice, sorry, for a foresight exercise, and then to Madrid, and then to Rome, and then to Tel Aviv. That was the last opportunity to meet together, not in person. So it was a very exciting exercise. But unfortunately, after that meeting, it was not possible any longer to have a meeting in person. And we hope to have the next one in Oslo in coming month, in November more specifically. So to monitor our research and innovation and to analyze and recommend uptakes, we have different ways. We established an innovation watch that is running every twice a year, and having also the opportunity to monitoring other EU projects, and also to make together the possibility to work for funding opportunities. We had also market analysis, business models, business supports, and also another point that was a focus in our project was standardization. That is something that in some parts of emergency medicine is still lacking. So just to make a brief reminder to our actions in the last year, we had, as I told you before, a workshop on hospital preparedness and security in Tel Aviv. When, as Chaim said us, we had the first COVID-19 case reported in the European Union. And just after the first meeting with our project manager that was held in Brussels. And after that, the pandemic hit our program as it hit our hospitals and our universities. In March 11, 2020, I remember that the Director General of the World Health Organization declared that COVID-19 was a global pandemic. So we reacted to this unfortunate situation, trying to move our specific competence at the time, as they were scheduled in the beginning, to the COVID pandemic. And we start to try to get supply and to serve ourselves to implement the response of others, being the first who had this bad experience in Europe. We're organizing a lot of seminars, specifically on topics that were of the greatest interest for all the people who would have liked to be involved in this strategy. So you see that at the moment here, there are quite 20 seminars that we have proposed during these last 18 months. And this, we pick up the titles and we, in the very problems that we had to face during the pandemic, and we try to share the contents most internationally as possible. We had participation, I think that we can say it without any doubts, that we put together so many practitioners, so many important institutions, so many academic centers, that they gave us the opportunity to have a great changes of competencies and projects and solutions. And this was very, very important to us. You see that the content of these webinars was so different in the perspective, but also in the same time, they were looking to make the figure the more complete as possible, you know. And sometimes we have a suggestion by our group of people in the no fear, but sometimes we got from people participating to our webinars the suggestion for more and more implementation of webinars contents. So this was a very, very, very great interaction between us and the other groups. So when the pandemic started, we decided to change our life. And this webinar series, as I tried to summarize before, we're aiming to involving a strong existing global network of practitioners involved firsthand in the COVID-19 response, also by creating opportunities for quick and dirty exchanges of information, practices, lessons learned, just to have immediate responses to which we had to face at that time. We try also to explore how different countries responded to the same challenges in different stages of the pandemic. And this was very, very important, a very, very good exchange of information. Also, we were investigating the availability of new developed tools or services for the COVID-19 response. So, if I have to answer these questions, why we agreed to share in the middle of the network, I think that there were different changes, different times. At the very beginning, the situation was exploding like a bomb that we were not expecting it. So at the very beginning, we had a lack of knowledge of clinical and therapeutic aspects that the SARS-CoV-19 and their effects on patients. I remember those bad times that we were not informed at all, and the first pathophysiological studies were coming out, but at the very beginning, it was very difficult to face these patients. Another point that was very important at the beginning was the personal protection devices, and also the general and specific risk protection inside the hospital, but also outside the hospital. The organization or reorganization of all the structure that were accepting patients, the creation of few areas where new intensive care we had to expand our emergency department. We have to change our attitude to treat these patients. So it was a big mess. And also the need to share contacts among different specialists to anticipate possible problems that were at that time unknown in the local settings. After that, we had to move to another point, that was the impact on emergency public health. To consider that this had become at that time a disaster. So either the emergency public health and also the ethical aspects that were correlated to the pandemic came up, and they were very difficult to tackle. So it was a very bad time, at the beginning. And among the waves, because in Italy we had 4 waves. The first very impacting on the emergency departments and the intensive care. The second that was mostly on the emergency department and on the wards, especially infectious disease wards and internal medicine wards. And after that, the third one was decrease in power, but it was always a problem mainly related to internal medicine departments and infectious disease departments. While the fourth one, at least in Italy, in a reversal way of the previous, were due to the fact that vaccines started to work, it was very less in power, but the games in different countries, obviously not rather than in Italy, had different need for response. Another problem came from the new variants. At the beginning it was Alpha, and then Beta, and now it's Delta. So every specific pandemic has different problems. And we had also the so-called infodemia, communication to the public that was not always managed in a good way. There was a confusion, overlapping, narcissism, and so on, that gave us a bad time to respond to some of the patient issues. We started to have social restrictions, the quarantine, the obligation to have the green passes we have in Italy, the due of people to be vaccinated, and now, and in the last months, and especially now, we had some way of reacting by people that were very strong, And so this is a problem that now is quite more important than a pandemic itself. And also disparities, the evolution of this pandemic in different parts of the world. And the new debate is coming if we need to vaccinate people, to renounce to vaccinated to the third dose vaccine, to give these vaccines to other people in the world. And also the vaccine and the new therapies that are coming. So it was a huge problem, and also a malignant problem because it's going to change every way and independently also of that. But there were some appealing findings that we had during that discussion. Silent hypoxia, disinfection protocols, reuse of PPE, telemedicine, supply chain challenges, psychosocial issues, use of convalescent plasma, the ventilation techniques, nursing homes, correlated lungs ultrasonography scores, and COVID in children. So these were the most appealing that we have through our discussion, but I think that they were very important point to our project. We had this agreement and this interactive work also to improve the dissemination through some studies that we have done during this time. There's our publication, improved collaboration and networking, and also some interesting report that have been uploaded in our website. So I finished my presentation. I hope to have given you an overview of our project. And of course, we would like to give response and to be absolutely open to possible collaboration that could be proposed by anybody of you who could give us the opportunity for new networks for the present and for the future. So thank you very much.
Thank you very much, Francesco. And I will go directly to the practitioner's experience. So, Paloma, on behalf of Salud Protección Civil Madrid, please go ahead.
Hello, good afternoon to all, and thank you for calling me for this interesting webinar. And we have participated almost in 20 webinars along the COVID pandemic. And there have been medical aspects, there have been logistical, training, everything. But in medical aspects, we participate mainly in ultrasound, pediatric, the new waves, and the lessons identified on ventilation techniques. But the real thing is the only one, the one of the ventilation techniques from the pre-hospital setting was made during the first wave. The rest of them were discussed when the worst wave have passed. The next one, please. Sorry, Jaime. The logistic aspects with the new disinfection technologies and supply challenge, and of course the training aspects were treated when the emergency wave had passed, the first important wave. But I think it was really great to delay them, because we wouldn't have had enough experience about this to analyze and to learn from them. So all this, I think all these factors need to be seen along the time, comparing, learning, and learning from the others. So it was logical to put them aside for a moment. And this one, the operational aspects, as you see, there were lots of them, and more than half of these webinars were done during the first wave, and were mainly of measures, experience, care of team members. I mean, they were not specifically medical aspects, but more operational aspects in a moment where a global impact of an unknown disease was causing so many deaths, and we were like in shock. So we had to learn one from each other. The other ones were at the second half of the year, and mainly treated from lessons learned from the first wave, like how we manage the human researches, how we made with the EMS operation, how we change the training, and this made us to analyze this in a realistic way, we had all seen, and I think it was very useful in the next waves. This is just a timeline of how we manage this. Next one. And the lessons we learned, mainly, there are lots of lessons learned, but the one we can take is first regarding to the EMS. We have to adapt our scenarios, our transportation, our collaboration, our facilities, our converting our EMS system in a COVID EMS system. Second of it, talking about the workers, how did we have to take care of them? How did we have to make some briefings every day to clarify, to to make them feel safe, training the PPEs, making them to feel safe, any question they did have. And then we did have our problem with the medical supplies, a lack of stock, stocks that were not certified, but we didn't know at that time. So all that we could learn. And of course, it put there later waves, but it's not the reality. It's from the beginning. Maybe we missed taking care of the emergency call workers, because we all in the pandemic, we were in contact, oh, we are heroes, but sometimes we forget about those who are taking care, taking the calls, trying to calm the people. And they did a fantastic job, and we could learn it in the lessons learned of the emergency medical call centers. So we have to say that. And we shared knowledge, one from each other, to practice learning tools, preparedness, addressing the analysis, the quarantine, the everything. But unfortunately, I think we will still have many issues to study from now on, and to take care of them, because the post-COVID symptoms, the long COVID illness, it's not very studied yet. And of course, the psychosocial support of healthcare workers and populations in general. Let's see how this pandemic goes. So we will have to have much more webinars, hopefully. So in conclusion, we think that the global lockdown forced our organization to adopt and to adapt to new ways of working and training. That's very important. As the pandemic was spreading around the world, we have a lot of demand of information, on practice, on how could we do, how could we protect, and response measures became very, very important. Of course, the sharing of knowledge, the learning tools, the experience, the best practices among professionals by these webinars has proved to be critical. And the share information, we should have it as a new public good. And as Voltaire said, is there anyone so wise as to learn by the experience of others? I think we are doing. And I really think that if you see something is working, just copy it. And that's what we have done with many, many webinars we have participated in. And that's all I can say.
Paloma, thank you very much. I think that, yes, the idea that we still have a long way to go is a major thing, and we should leverage on the strength of our network. So thank you so much also for taking the time in the midst of the nightmare to share with all of us.
Thank you.
Susan, please go ahead. Thank you for being with us.
Thank you very much, Kaim, and thank you everyone for accommodating my request. I'm sorry to join late. I was in the middle of a meeting in Tanzania, but I will go straight to my presentation. My name is Susan Ngonga. I'm the Managing Director for E+, which is the Emergency Medical Service for the Kenya Red Cross. And I'm happy to have this opportunity to share our experiences of the COVID-19 operation in Kenya. So E+ today is the largest private emergency pre-hospital care medical provider in Eastern Central Africa, and it is fully owned by the Kenya Red Cross. We have a fleet, the largest fleet that is equipped with state-of-the-art ambulances, 24-hour tech-savvy dispatch center, and highly equipped and professional staff who work cohesively together to bring world-class pre-hospital care to those we serve. As I said, we are fully owned by the Kenya Red Cross, and we offer our services on a commercial basis and on corporate social responsibility in support of the mission of Kenya Red Cross of alleviating human suffering. We operate 2 ambulances in the form of basic life support and advanced cardiac life support to international standards. So since the coronavirus pandemic in 2019, the Ministry of Health has stepped up preventive and mitigation initiatives such as mass vaccination program to curb the spread and death of this outbreak. To date, we have over 250,000 COVID-19 cases that have been confirmed in Kenya, with 4 million being fully vaccinated. Certain measures were undertaken by the Ministry of Health, which include nationwide daily curfew from 10 p.m. to 4 a.m. There was ban on social gatherings, which continued to run till the 4th of November, 2021. Mass vaccination program is continuing, and we are also receiving a lot of vaccination from our partners. Public sensitization campaigns on the importance of washing hands with soap and water, use of sanitizers, social distancing and wearing of face masks, capacity building of county health providers on contact tracing, rapid response, and use of data management teams. So some of the main activities undertaken by IPLAS included sharing experiences and addressing challenges through peer-to-peer discussion and continuous medical education. We also ensured that the staff were equipped with proper PPEs and continuous training on donning and doffing procedures. Maximum reduction of risk to personnel by practicing high level of infection prevention and control measures and strict monitoring to ensure compliance. We had daily debriefings and psychosocial support to the staff and prompt response to emerging issues. We participated in webinars and finding relevant fact-based training for our staff to equip them with adequate information on COVID-19. We also worked closely with the Ministry of Health to evacuate suspected and confirmed cases, and we were the only provider that had the capacity to handle these COVID cases on behalf of Ministry of Health. We did contact tracing and movement of identified contacts to quarantine areas. We supported screening in some counties and participated in sensitization and awareness creation in the community. Aid as response, rapid response teams in sample collections and transfer to laboratories for testing. We also had real-time data capture and sharing of national trend monitoring. We did continuous testing of staff, which was vital in guaranteeing the highest standards of safety. Preparedness was a multifunctional effort to ensure smooth running of evacuations and transfers. Increased demand for adequate supply of personal protective gear for all frontliners was very important as part of the lessons that we learned. High demand for psychosocial support for the ambulance crew due to the uncertainty and misinformation from stigma. Continuous daily briefings facilitated timely address of key issues of concerns for smooth operations. And continuous motivation to the staff during the pandemic was a very key lesson for us. Group therapy support for staff affected by the pandemic was equally very important, and we had WhatsApp support groups created that members could socialize and share their experiences. On areas to improve, we noticed that there was lack of preparedness of other partners, and this was important. Government and private institutions to prepare adequately for smooth process to receive patients infected with the virus. This would enhance our handover processes. Close collaboration and coordination of activities together with all stakeholders in the fight against COVID-19 is one area of improvement that we noted. Adequate stocking of PPEs and prudent utilization was also very important. With the inflation of prices at the beginning of the pandemic and increase of confirmed cases, there was high demand for PPEs, frequent meetings to monitor trends and respond to emerging issues, and also improve preparedness of facilities and equipment required for case management. There was need also for improved workforce mobilization and adequate preparation of response. So international knowledge sharing was very important for us, and because this was the first time for us that we were dealing with a pandemic, we found that it was very important to share knowledge internationally, and this enhanced the sharing and adoption of best practices among different players. We at IPLAS learned a lot from our collaboration, especially with the Magen David Adom in Israel, and also from the forums like No Fear, Wadem Forum. We were able also to purchase our first portable isolation chambers for evacuation and understand how the ISO acts have aided in safe evacuations of those confirmed with COVID. International knowledge sharing also helped to build synergy, collaboration, and cooperation between different entities involved in dealing with the pandemic.
So, Susan, thank you very much for your presentation. I think that the idea that we had this collaboration between different continents,
yes,
and gave us a unique opportunity to address different realities in different countries. And I hope that since you were lucky to be late in your cases, we managed to help you to deal better than our very hectic days at the very beginning of this pandemic. So thank you very much for being with us. We saw the situation in Africa, and now we will go to the continent where it all started. And please, Von.
Yes, thank you, Kaim, and good day to everyone. So to discuss about the challenges and response of the Philippine Red Cross for COVID-19 pandemic. Just to start, my name is Von Ryan Ong. I'm the Safety Services Manager. My department handles the EMS services and also the training. But our scope during the pandemic were extended to a different support to the battle or to the war for pandemic. So who we are or what we do. The Philippine Red Cross is a 70 years old service in the country. We have been unstoppable in fulfilling our mandate as an auxiliary arm of the government in fighting emergency health issues, disasters, and other means of disruption to the community. Through our volunteers, logistics, and information technology, the PRC has been always first, always ready, and always there in responding to any events. During the pandemic, as I mentioned, we handle our emergency services. The early stage of the pandemic, we are really in the blind side or in the cloud that we cannot respond immediately. There were back and forths of the discussion between the Philippine Red Cross and our health ministry in making sure that we can cater the responses or requests of COVID positive patient. Actually, we started discussing not only for emergency services, but also as a whole response of the country, as we are the auxiliary arm to the government. Focus on the emergency services. As of today, since last year, when we started in March, our lockdowns, we already catered to 981 patients that are COVID positive, and other responses were considered as a possible COVID responses. And as of today, we already responded to nearly 6,000 patients for COVID and non-COVID. This is a effort of our 103 chapters all over the country that are responding not only for emergency, but also for the pandemic. So to protect our responders and our frontliners, we created our interim guidelines for emergency medical services. These guidelines are like a Bible for the volunteers and staff for EMS, not only for the ambulances, but also for other sector in fighting against COVID-19. This interim guidelines include also the management of patient inside the ambulance, outside the ambulance, also managing our internal offices in our headquarters and our chapters. These guidelines also include media. We use video-based training for our volunteers and staff for donning and doping for PPEs, hand washing, alcohol rub. Also, we created our training program for managing our ambulances, especially our negative pressure. So to emphasize our ambulance unit or ambulance support, we have 171 ambulances all over the country, and 6 of which are negative pressure ambulance. We purchased these ambulances during the early days of pandemic. So the lockdown started in the country March 15. Then fortunate enough that we have the capacity to export the ambulance from China, that give us another layer for protection for our responder. Actually, I usually quote this as a triple layer or 3-layer protection for our responder. First, the PPE. Second is the isolation chamber. And for the ambulance itself, it's include a negative pressure within the ambulance cabin. These ambulances were distributed to different regions of the country that were being utilized for responding for COVID in their local chapter. To give emphasis also for the ambulance, we created a marketing video or a ad video that I'll be showing after this slide to give hope to our countrymen that we are ready to support and respond to the need for the COVID pandemic. Next, we also responded in the needs of testing our public or our community. The Philippine Red Cross now have 13 molecular laboratories which are spread also in our country. Unfortunately, the government only have one laboratory that can do testing, which is very limited. That is why our chairman and our management decided to go into venturing to a molecular laboratory. And now, as we speak today, we already nearly tested 5 million individuals for the whole country. And this relates to 25% of the testing capacity or testing capability of the whole country. So we are a big support to the government in detecting persons or individuals who were who were infected by COVID-19 and make sure that we can separate them from other people to our isolation facility, government or the Philippine Red Cross. In response for the protection also for our staff and volunteer, and even for the community, first we prioritize our team, our ambulance team, our frontliners, our staff for vaccination for COVID. So fortunate enough that even though we were unable to secure a large amount of vaccine from the supplier, eventually there were support coming from the government that we were allocated certain numbers or units of vaccine for us to make sure that we are protected and we can support the government throughout the fight against COVID-19. So as of today, we have 319,000 vaccinated individuals, and we launched actually a vaccination buses that were spread also in the country, that were going to a remote places, far-flung area, to reach the unserved people under the vaccination program of the country. And also we created and partner with big malls, shopping malls, to be the venue for our vaccination site. So people can just register and go to the mall, and they will be vaccinated by the Philippine Red Cross. In connection to the continuous support to an individual who were tested positive. So once we detected an individual who is infected of COVID-19, we can serve them, or we can bring them to our isolation facility. When I say our isolation facility, this is a partnership with local government and schools, private and public, that we converted our classrooms to a isolation facility. This isolation facility are intended for our asymptomatic patients, and we have 24/7 medical staff that can monitor the patient, doctors, nurses, aides, and all the provision that are needed by the patient were given through the support of our donors and partnership with other stakeholders. So as of today, we have operational 5 isolation facility, and we already serve 4,600 individuals. And we are creating more isolation facilities, especially up north in the island of Luzon. By this week, we will be operational the 6 isolation facility. The isolation facility are for asymptomatic, while our emergency field hospital, as you can see, is for symptomatic from mild to severe or moderate patient of COVID. And this is a partnership to our Philippine Lung Center, the main hospital that caters for respiratory concern. The emergency field hospital are located in the compound of the hospital because we need to have a continuous coordination with a hospital and our emergency field hospital. We can do upgrading them to the hospital side, or they can also step down from a critical patient inside the ICU of the hospital going to our emergency field hospital. As of today, we have 51,723 individuals that are being served by our medical tents or emergency field hospital. This is in support to 62 hospitals all over the country. There are also efforts in providing a higher survival rate for COVID patients by transfusing convalescent plasma coming from a COVID positive recovered patient. So we have our convalescent plasma center in our old office that we can get and filter the plasma that contains certain antibodies going to that can be transmuted to the patient that has been infected by COVID in a moderate to severe critical patient. And fortunate enough that a lot of recovered patients were interested to help the current COVID positive patients. So we already collected 1,145 units from 1,014 individuals that can support in convalescent plasma program. Our conventional first blood donation is still ongoing, even though we have a decrease of the donors for blood because of the scare of getting out and going to the office, traveling to the blood centers. So our blood services conducted mobile blood donation, meaning they are the ones who's going out for a group of people that would like to donate, or even getting the people, ferrying them from their house, going to the blood center just to make sure that they can donate blood, and we can serve our community with enough blood supply for their other illnesses, not only for COVID related. So as of today, we already collected 242,628 units and served 123,681 patients for this year's alone. Because of the disruption of the economic in the country, we also take pride in our hot meals on wheels, or we provide meals for the affected community or local barangay by serving them hot meals or rice toppings that gives them for their main course or main meals for the day. And this is a continuous effort until today. As of now, we already have like 20 plus hot meals on wheels that are roving around the community just to serve food for the most vulnerable. So we have already 100,173 beneficiary of hot meals. And along with this effort, our welfare services continues to provide psychological first aid or counseling for our community that might be experience trauma in having COVID positive result, or the relative are positive on COVID. Then even though with the pandemic, we also continue our dialysis center. This is the first dialysis center for the Philippine Red Cross. We already have like 15 seats that can cater for the patient for dialysis. And this is also in support to our dialysis center of the government, because unfortunately some of the hospital were infected, or the personnel in the hospital were infected. So some of the patients were catered by the Philippine Red Cross or extended to the emergency field hospital. As of today, we already have 13,161 patients served in our dialysis center. And to accumulate or culmination of our efforts to COVID-19 pandemic war or battle, we have a video presentation to capture our efforts for our responses. To mind you, we are not only tackling the COVID-19 pandemic crisis, but also early last year, we have a volcanic eruption, multiple typhoons that hits different part of the country. So the Philippine Red Cross is really a multi-sector response and support to the government. So to show some of the summary of our responses, please watch our video. Thank you.
Sa nagdaang 15 buwan, sa pamamagitan ng mga walang kapagurang kawani at volunteers ng Philippine Red Cross, naipakita natin sa buong mundo na kahit gaano kabigat ang pagsubok na dumaan sa ating bansa, basta't sama-sama tayo. Together, we are unstoppable. Sa pagputok pa lang ng taong 2020, sinalubong na tayo ng biglaang pagsabog ng Bulkang Taal. Nabalot ng makapal na abo ang maraming bayan, kasama na rito ang Kalakhang, Maynila. Pagsapit ng buwan ng Marso, tumama sa ating bansa ang pandemya ng COVID-19. Maraming nawalan ng trabaho, marami rin ang nagkasakit. Isang malakas na lindol naman ang bumungad sa atin noong Agosto. Nangyayari ng 6.6 magnitude na lindol ang probinsya ng Bicol. Sa nakalipas na 15 buwan, mahigit sa 20 bagyo ang pumasok sa ating bansa. 12 dito ang tumama sa kalupaan. Ang sunod-sunod na bagyo noong buwan ng Oktubre hanggang Nobyembre ay nagdulot ng matinding paghihirap sa ating mga mamamayan. Ang mga bagyong Quinta, bagyong Rolly, at bagyong Ulysses ay nagdulot ng baha at malawakang pinsala. Lahat ng ito ay nangyari habang rumaragasap ang pandemya sa ating bayan. Isang testamento ang nakalipas na mga buwan na puno ng pagsubok ang adikain ng buong Philippine Red Cross na makatulong sa ating mga kababayan. Isa rin itong patunay na anuman ang ating pagdaanan, basta tayo ay sama-sama, lahat ay kayang-kaya, lahat ay magagawa. Together, we are unstoppable. Nasa puso ng bawat kawani at volunteers ng Philippine Red Cross ang mga katagang. Subukin man tayo ng pagkakataon, hamunin ng panahon, hampasin man ng bagyo, yanigin man ng lindol, pasabugan man ng nag-aalbuhutong bulkan. Hindi tayo mapipigilan. Lagi tayo ang una. Lagi tayong handa at lagi tayong naroon kung saan tayo kailangan. Pinadapaman ng kalamidad at sakuna, basta't may nangangailangan, hindi mapipigilan ang pagtulong natin sa kanila. Hahanapan natin ng paraan, walang maiiwanan, walang makaliligtaan sa pag-abot ng pag-asa. Hindi tayo mapipigilan. Hinarap rin ng Philippine Red Cross ang hamon sa kakulangan ng mga kama sa mga ospital. Naitayo natin ang mga emergency field hospital at emergency tent sa Lung Center of the Philippines at National Kidney and Transplant Institute. Hindi tayo tumigil doon. Agad rin natin itinayo ang mga isolation facility sa mga universidad ng Ateneo, Lasal at UP. Bagamat mabigat ang laban sa pandemya nito, hindi kami susuko. Pandemya ka nga, pero Philippine Red Cross kami. One of the greatest human quality is that of becoming unstoppable. You become unstoppable by refusing to quit. No matter what happens, our determined spirits make us unstoppable.
Thank you, Kaim. That's all for the Philippine Red Cross response to COVID.
Thank you very much, Von. Indeed, the Philippine Red Cross is a benchmark in humanitarian work and disaster preparedness and response globally. So thank you for your work and thank you for the amazing work you are doing for the Filipino people and globally. It's an honor to be associated with you. So I would go and talk about Israel. And just to introduce you to Magen David Adom, we are the Israeli Society member of the International Movement of the Red Cross and Red Crescent Societies. And as such, we are auxiliary to our public powers during emergencies and disasters. And in Israel, we are in a situation of disaster during the COVID pandemic. We are the National Blood Service, and we are the Israeli Public Emergency Medical Service, the EMS. We are a small organization when it comes to staff members with a very large cadre of volunteers, some of them acting as first responders, driving motorcycles, small electrical cars or bicycles to respond, or driving with an emergency medical kit in the trunk of their private car. And we are extremely proud to say that we represent all the groups in the Israeli society secular Jews, ultra-religious Jews, Muslim, Christian, Druze, and other groups that compose our very, very interesting society, and they are all represented in Magen David Adom. When it comes to our COVID operation, very similar to the one of the Philippine Red Cross, we took more than 5 million tests of PCR tests that were sent to the laboratories. Magen David Adom does not run its own laboratories, 1.5 million rapid antigen tests. We collected more than 23,000 convalescent plasma units that were provided to people that were in critical conditions in those days back where vaccines were not available, and that was the best treatment available. We put more than 1 million shots of vaccine into the arms of people. Extremely proud to say that Magen David Adom was tasked by the government to vaccinate all the people, the most vulnerable people living in long-term care facilities. We did that in the end of 2020. Within 3 weeks, we vaccinated all those living in long-term care facilities, the elderly people, the people with chronic diseases in their elderly care facilities. And again, after 3 weeks for the second dose, and now for the third dose, protecting really the most, those who really need that most. And we are, as the EMS, treating and transporting people who are suspected or confirmed as COVID patients with our ambulances to the different hospitals and back to the long-term care facilities, a major operation which is going on. So I would like to pay tribute to our people. So what have we learned throughout this international cooperation? New clinical stuff. My whole life as an ambulance crew member, I've been told that I should not trust the pulse oximeter and the monitor. I should trust the clinical presentation of my patient. And then suddenly, throughout this cooperation, we realized that in COVID, we have patients who clinically look very well. Their saturation is horrible, and they will crash. They will crash in minutes. We call it the silent hypoxia phenomena, something that saved many lives in Israel, because the moment we were able to alert our staff members about, staff and volunteers dealing with patients about this phenomena, they could advise people that did not want to go to the hospital, that they are in a life-threatening condition. And I can tell you countless stories about these cases that people were like, but I'm okay. And really they got to the hospital and were saved on minute 90 or sometime 95. And that's really something that we were able to bring to our volunteers and staff very early, before many others were aware of it, just because we heard about it from our colleagues in Italy, our colleagues in Spain, who were seeing this phenomena. we were inviting the procedure as we were flying along the pandemic. We, with the best contingency plan that we had, we didn't imagine the extent, the complexity of the situation. So for us, these webinars were the fora where we could discuss, challenge, and in many cases reaffirm our thoughts or the way we were doing things, and we could go to our management and say, maybe it is not the best, but this is the way it is being done also in other countries, like in Italy, like in Spain, where they were at the highest point of patients being treated. And by doing that, at least we were doing the same things. At the end, we realized that they were the right things. But it's much better challenging yourself with ideas from other countries than just it's my own brains who brings that. And in those moments of our uncertainty, this was one of the key issues for us. Issues on supply chain, and it's not just medical supply chain. We are all talking about medical supply chain, about PPE. We had issues with computers that we didn't have spare parts just because there were no international flights, and other issues that we could bring early enough so we could prepare ourselves and make contingencies. And doing a real preparedness is thinking in a holistic way, not just about a current issue like my medical supplies. Ideas about caring for our personnel that was over and over mentioned again. They are the heroes. They are the ones who did the job. And we really had to think about their well-being. And through these series of webinars, we got many positive, incredible ideas on what can we do with them. Professor Della Corte spoke about the infodemic, about the misinformation, about creating trust. No one had the solution, but many people had very good ideas about concrete things that could be done, that we implemented and really helped us to create this trust with our volunteers, with our staff, with our communities that we are serving. And at the end of the day, they are why we are doing what we are doing. New technologies were brought in about disinfection, about personal protective equipment. All those were so important, and some of them were implemented in Magen David Adom throughout the pandemic itself. And we thought it's over, and we thought it's over June 2020 after the first wave. And then we had the second, the third, and now we are getting out of the fourth, praying to God that we will not see the fifth. But learning is key for us. And it's our obligation to learn one from the other, from one event to the next, to be better prepared. And what we realized is that in order to be prepared, only together we are stronger. For us, this is the key, and being part of this network, of the No Fear network, for us is being stronger. So I would thank you for listening to Magen David Adom presentation, and I would share with you two emblematic images from the pandemic. One at the bottom is of a crew working regularly in Beersheba station in the south of Israel, an ultra-religious Jew with an ultra-religious Muslim. They are the team. Every morning, they ask their dispatcher to allow them for a short morning prayer. The Jewish guy is praying to Jerusalem, so it's to the north, the Muslim to the south, both Israelis. And when they are asked what are they praying for, the answer is for this pandemic to go away. It looks like it will stay with us, unfortunately. And on the top, you would see the municipality of Jerusalem lightening the walls of the old city of Jerusalem with a statement, Jerusalem salutes Magen David Adom, in recognition of the work that our volunteers and staff did during this pandemic. So I please the editor cut us here, and we go back here. And without further ado, I would hand over to the moderator of our panel, Itamar, please.
Thank you, Chaim, and thanks to all the speakers in this very interesting webinar. I think all of your presentation were enlightening, and it is impressive to see how organizations share knowledge. And I have several questions for you. I would like to start with Paloma. My question to you, if you don't mind, is, I mean, all of you mentioned the knowledge sharing between the organizations. And I wanted to know if you can share with us what was your most important lesson learned that you picked up from others during this COVID pandemic.
Well, obviously the experience of other organizations and countries that had an earlier breakout was crucial to us, because then we had lots of infected people, and we learned a lot from managing the pandemic, from isolation, from EMS, hospital coordination, PPEs, lack of stock, everything. So it was, for us, it was crucial, this experience of the others. It also boosts the collaboration between the other organizations, and what's very important. And sharing our knowledge has been a critical element for us of a successful management efforts. In that moment, it was more important than searching from the literature, for medical literature, in the internet, in the whatever. Our sharing, I think it was the best thing we could do for learning from each other. So it was very important for us.
Okay, thank you, Paloma, for these examples. My next question will be to Professor Della Corte. And my question to you, as a project coordinator who runs the project and has relations with different organizations, how difficult was it, or what level of cooperation did you receive from the different partners in the project when it comes to knowledge sharing? Was it difficult to motivate them to share the knowledge? What did you do to improve knowledge sharing within the project between the partners?
Yeah, in fact, there was no troubles to do that, because the attention of different partners to what was at the very beginning fully unknown, it was it was perceived, at least as a great opportunity to improve their own knowledge. And so we had no problems since the very starting of our activities dedicated to COVID-19 pandemic. And people participate as auditors at the beginning, but immediately later they propose topics. They ask to have information. And I remember that as I told before, Italy was, especially the northern part of Italy, was hit at the very beginning. So we were at that time who were the first experience. I don't want to say the most experienced, but the first that were experienced to exposition of COVID-19. And so there were a need for a lot of people to ask us information, to ask us the way we reacted, to ask us how problems could be solved. This is not, I don't want to say that we were ambassador of reaction, but in fact, because so many people made it probably much better than we did. But for sure, I can assure that there were a lot of interest from people, either in no fear participant, but also outside of that. There was a great interest to join to the network and to improve what their knowledges were. And so I'm personally, I'm very satisfied about that. And I would like to thank also all the members of the managing board, but also the members of all the consortium that were absolutely immediately active in giving the support to increase the panorama of the no fear. And so I think that it was a very, very, very interesting and productive work that we have done in our project. So thank you to all the practitioners, to all the suppliers, to all the academicians, to all the people who work inside our project, because they made a very good work. And also to all the people who participated just because they were interested in what we were producing.
Yes, thank you, Professor Della. And I think you said you're satisfied, and it is very satisfying to hear what you just said, that it was easy to have the cooperation between the partners, and this knowledge sharing was achieved quite easily. Thank you for that. Von, I have one question for you too. You mentioned in your presentation different new roles that your National Society organization received or took during the pandemic. You mentioned the samples, vaccinations, the plasma from recovered patients. And my question is, how did the organization learn these new roles? What means did you have to achieve knowledge to perform those new tasks?
Yes, thank you. Actually, it's very difficult for the Philippine Red Cross to start whatever endeavor that we took from the past years. But we need to make sure that we carry our load. The Philippine Red Cross carry its load in supporting to the battle of the COVID-19. So in response to what we did to make sure that we can carry our load and contribute to the fight against COVID, of course, we are referring to other countries like MDA for the guidance and protocols that we need to make sure to have in our responses. We also partner with a university in Illinois in the US in upgrading our molecular laboratory in not only doing a saliva swabbing or swabbing for COVID-19, but also for saliva collection to be tested for RT-PCR. So a lot of coming from our external partners, friends, are really had the vital role in our efforts to fight against the pandemic. These are very vital because as within the country, we don't have that kind of information or study within us. So we need to extend our research, extend our collaboration with other stakeholders outside the country to make sure that it will be a local practice and response of the Philippine Red Cross and also for the government. Thank you.
Thank you very much. I think for many, it was new experiences. So again, the knowledge sharing between different countries or different sectors, organization was crucial. Chaim, my final question for you is a difficult one. We mentioned the knowledge sharing and the benefits of it, but maybe there are some challenges within knowledge sharing that you can share with us now.
I would say the most important issue, as in many other aspects of COVID-19, is about trust. Knowledge sharing is not just about sharing your success stories. It's also about sharing your challenges, the issues that you faced, and sometimes your failures. And you learn as much as You learn from success stories, also from the failures. But you have to trust the people that you are sharing with, that it will be used in the right way. And if someone says, and we saw it during the pandemic, we had to decide which patients are we going to ventilate because we did not have enough ventilators. It's an extremely important point in your preparedness, in the way that you are thinking about what happens if, and this is the key question that you ask when you are preparing. But you need to trust that it's used this way, and it will not become tomorrow a headline in all the newspapers in your country X or service X or hospital X are letting patients die because they don't have enough ventilators. And I think that the great advantage that we had in No Fear project was this level of trust among the partners that allowed us really to discuss tough issues, understanding that some countries are already facing them, other countries might be facing them in the future, and the only way we can prepare is discussing them and keeping that in a way that we are professionals, and professionals appreciate honesty. And we don't try just to hide behind our success stories, and we are not there sharing because saying how wonderful I am is not sharing. It's a very small portion, and sometimes you learn more from the issues. So I would say we are privileged to be part of this network that was really honest and open. And I know that some colleagues did not sleep enough at night preparing the presentation for us, and we admire them for that. So thank you very much.
Indeed. So having those networks with trust and with organizations and people that you know is a crucial part of this knowledge sharing that supported so well and so many during this new challenges brought by the COVID-19 pandemic. Thank you very much to all the speakers for your answers. Jaime, if you want to close the call.
Yeah, I would just say that the word on the slide is hope, and hope comes with the vaccines. So I personally would use this opportunity to ask everyone who can get the vaccine, please do that. That's our way out of this unique, challenging situation is by getting the vaccine. This is our hope, and I will hand over to Professor Della Corte to conclude this webinar.
Thank you, Jaime. I'm really satisfied of it. I think we have succeeded to give a real global presentation, because there were people from all the continents and with the same problem, you know. So the way that the COVID-19 acted in a good way was to implement the networking and to implement the exchange of ideas, implement the change of procedures to improve our quality of work, and to give us the perception that we all in all the continents, we are working together in a global environment. We are not alone, and we need to implement the perception that we can get anything for everybody. So thank you very much for having organized this conference. I'm really sure that it will give a good, that it has given a good output, and I'm also sure that it will be useful for anybody who will be hearing to that. So thank you very much again for having attended this session and for having given your presentation and as witnesses of your personal work. I think that it was a very productive seminar. So I'm very, very happy about that. Thank you very much to every one of you.